Welcome to part 3 of the PISCES training video.
So far, we have prepared the plasmid and set up the EP device. Here in part 3, we're going to review the actual administration of the treatment.
Patients are anxious when they come in for treatment or procedures. This is especially true when they are starting a new treatment. There are, however, several measures that may help the patient prepare and be more comfortable during EP treatment. An ice pack, numbing cream, or lidocaine may help to alleviate some of the pain and anxiety associated with receiving EP therapy. The patient may also receive additional medications prior to treatment, such as lorazepam or morphine.
But basically what happens is the patients are seen by myself. We print off the order, the pharmacy makes it up. Once the pharmacy makes it up, the patient's then brought back into my room or a treatment room. We use an ice pack to try and numb the area a little bit for some local discomfort from the injection. We use a little bit of local anaesthetic if needed for pain relief for the injection site. Patients haven't reported any significant discomfort. We then use the probe. Now the probe is something that does take a time or two to practice, and it was worthwhile practicing before we started. And we insert the probe. We then step on the button to allow for the electroporation to happen. And it's over in about 2 or 3 minutes.
If topical measures are used, they should be applied prior to sterilization of the treatment area. Once the patient is brought in, the treatment area should be prepared and sterilized for treatment. Lidocaine can be injected around the lesion perimeter, but care should be exercised so that lidocaine does not displace any lesion volume inside the lesion. Next, the investigator will take the first syringe of Tavo and inject the corresponding lesion. The lesion should be injected on the periphery of the lesion rather than the necrotic center, if applicable. An investigator may inject the lesion in multiple locations for complete coverage, or they may use a fanning technique to distribute the Tavo. The investigator selects the desired needle length on the device tip and place the needle into or around the first lesion slated for treatment. The needle depth should co-localize with the location of the Tavo injection. By pressing the foot pedal, the treatment is initiated. The generator will go through a few seconds of testing, followed by 6 pulses of treatment. For a small lesion, this may complete the treatment. For larger lesions, additional electroporation may be needed. The patient continues to be treated until all lesions that were selected for treatment are covered. The research nurse or study coordinator asks the patient to rate their pain level immediately after the last treatment is complete and document the response. Patients should rate their pain from the treatment on a scale from 0 to 10. After 5 minutes, the research nurse or study coordinator should ask the patient to rate their treatment pain level again on a scale from 0 to 10 and document the response.
Hi, my name is Dan O'Connor. I'm the CEO of OncoSec. I'd just like to take this moment to thank you for participating in this training. I myself have been received electroporation because I wanted to understand firsthand how our patients felt. So I just wanted to finish by saying thank you so much for all that you have done for OncoSec, for this clinical study, and for the success of this clinical study. I'd also like to thank the investigators, their staff, the study coordinators, everybody that's associated with the study. But most importantly, I'd like to thank the patients and their families for participating in our clinical study.
Along with you, our goal is for each patient's experience to be as positive as possible. We hope that you find the details that we covered in this training video helpful. Please feel free to revisit this training video as often as you'd like to review these procedures. You can also reach out to your clinical trial associate if you have any questions.